I'm Jim Csek. You're watching Kelowna Now, and I have with me here John Rustad, the leader of the Conservative Party of BC. And you just released your healthcare plan. Do you want to tell us a little bit about the plan?
Sure. Well, as we all know, in healthcare in British Columbia, we are in a crisis. Our system is failing. When you look at the ER closures, when you look at the wait times, the fact that we're having to send patients across the border, the shortages we have of doctors and nurses, 20% of the population, 1 million people in BC, don't have a family doctor. I mean, we're in a real crisis, and we need to be looking at how we deliver healthcare in BC. Throwing more money at the system is not the answer. The system itself is the problem. And so what we are doing is we're actually looking at a model similar to the European models, where it is universal healthcare, but we put patients first. We put patients at the center of the decisions, and the services are delivered by both government and non-government organizations.
Yeah, so I read through your plan here, and it says there's a couple of things. It seems like you're outlining, saying the bureaucracy is really bad here in British Columbia, like even comparing it to Alberta for just in, like some of the administrative staff. So obviously that's not going to go well if you're talking about cutting. And I think I think Alberta did a similar model, cutting more of the management and adding more frontline workers. Is that kind of similar to what you're saying?
Well, it's more than that. Administration is definitely a problem. Look, I mean, I've been told close to 40% of our nurses are administrators. When you compare Germany, a country that is twice as large as Canada by population, and yet they have 1/10 of the number of administrators. We have 10 times more administration in Canada than we do in places like Germany. And so we need to take a look at the whole administrative model, but with the purpose of not trying to cut funding, but the purpose of trying to make sure that we allocate funding to patients, to make sure that we have funding follow patients and that we put patients first, and we put in the measures that we believe we need to put in to be able to reduce those wait times and be able to deliver the services for people in British Columbia.
And your number 2 point there, you're saying patients first, wait time guarantee, implement a patient-based funding model, giving patients the choice to access care sooner. Can you explain that to me?
So essentially what we do today in British Columbia is hospitals get a block funding. So they may get $1 billion. And if they have trouble meeting their budget, they cut services, they close beds. And instead of doing it from that way, what we want to do is we want to look at actually having the funding following the patient. So if you want to generate more revenue, work on how you can improve services and increase services for people. That's a key piece in what we want to be able to do in terms of funding. But when it comes to the actual guarantee, we need to actually be able to measure and show what our wait times are compared to what, say, national or even international standards are. And where we are unable to meet those standards, let's look at where else we can potentially get those services, whether that's outside of Canada or where that's within Canada. So let's not be afraid to be looking elsewhere to be able to deliver services that we could desperately need to bring down those wait times. Of course, the main focus needs to be on doing that within British Columbia.
Yeah, so that doesn't mean anything about the patients having to pay anything, right? That's still funded by the BC government, though, right?
But that's what we mean by universal healthcare. It is
Right.
universal. It is available to everybody. It's a single payer. It's government that is buying services and making those services available for the patients that need it.
And then in your point 3, you're talking about the ER closures that we've seen all over, like the smaller communities across BC that it seems like to be every weekend we do one now, or every week. And that part of that plan is to hire back the fired healthcare workers. Is that correct?
Yeah, certainly. I mean, we're in a situation where we need every single healthcare worker that we can in the system. And there was about 2,500 healthcare workers that were fired, but there's somewhere between 7,000 and 10,000 that left the system because of the vaccine mandates. We're the only jurisdiction in North America that still has these mandates in place. And it seems to be more about ideology than it is about working with patients. So we'll remove those mandates. We'll offer the jobs back. In places like Mackenzie or small communities right across this province, a nurse or a doctor could make the difference as to whether or not an ER facility might be able to be open and available. So we need to be able to bring those people back into the system as best we can. But that's only part of the puzzle. We need to look at how we reduce the administrative burden so that doctors have more time to be able to service patients. We need to look at how we improve the qualification process for foreign doctors, foreign nurses, foreign healthcare workers that come into Canada, so that they're not waiting so long. They could be up to 4 years before they get a chance to be able to actually service the people in British Columbia. And then, of course, we need to expand out training, both domestically as well as look at potentially even buying training spaces from outside of Canada to be able to make sure that we have the stream of healthcare professionals we need to be able to deliver services here in British Columbia.
One of the things about the small or more rural communities is that it's tough to even convince a doctor or a nurse to kind of go up there. And I guess that's why they suffer more so, because they don't have any kind of like surplus. And you say in here you have a plan to incentivize some people to move to the more rural areas.
Yeah, so for example, if you want to be a doctor serving in the military, the military covers the cost of you training to be a doctor, and then you give them 5 years of service. We could look at a similar type of model where we can train, or we can cover off potentially student loans, whatever the case may be, and have them come in and serve in an underserved community in an area of the province that desperately needs them. So we can look at doing those kinds of models. There is incentives already in place, but we're going to look at just, what is the barriers with people who are in the system to considering working in those underserved communities, and how can we help as a government to be able to remove those barriers, or create those contractual arrangements where we can have people in the communities being able to help build out those services that are needed.
Yeah, and then you talk in your point 4 there about protecting and supporting frontline staff, about a zero tolerance policy on illicit drug use in hospitals. You want to expand on that a bit?
So what we've seen with David Eby's approach with decriminalization and safe supply is we've seen these drugs being brought into the hospital and actually being used in the hospital. We've had nurses that have complained to the worker safe, saying that this is an unsafe environment, and there's nothing that can be done because it's been decriminalized. So these are the types of things that we will, along with eliminating decriminalization in British Columbia, we'll make sure that illicit drugs are not allowed to be used. We'll make sure that we've got security in place, so that we can protect our frontline workers who are desperately trying to provide those services for people in hospitals.
Yeah, so there's been some reaction already to your plan. The NDP has come out. Ravi Parmar has said that it would mean a loss of $4.1 billion in health spending. Reaction to that?
Sure. I mean, that's an outright lie. And there's no other way to put it. I mean, the NDP cannot defend their healthcare policies. They cannot defend the crisis that they've created in healthcare in British Columbia. And so they're fear mongering through just outright lies. We have no mention whatsoever of reducing costs or reducing the amount of funding we have. Matter of fact, we need to expand the funding that we have to help with the transition and to make sure that we deal with the backlog. So I don't know exactly where they're getting those numbers from. All I can say is I'm expecting this from the NDP. They cannot defend their policies. They cannot defend the damage they've done to this province. So they're just simply going to fearmonger, and where they need to, they'll just lie. And they don't seem to have any problem with doing that.
And we've seen just even from our newsroom that it seems like we're accelerating in the closures. I'm not sure if it has anything to do with the spring and the summer, but it seems like we're doing a lot more of those press releases, especially for the more rural communities.
Yeah. No, I mean, like I say, our healthcare system is in a crisis. You have nurses that come out of school, they go into the system, and within 5 years they say, oh my God, I can't carry on with a career like this. I'm leaving. You've got doctors, because of the Health Professions and Occupation Act and the huge restrictions that are put on there, as well as the work environment, that are looking at leaving British Columbia. And as many doctors are leaving as we're bringing in. This is what happens when you have a crisis. I mean, in British Columbia, 1 in 3 people in British Columbia are thinking about leaving BC. 1 in 2 youth are thinking about leaving BC. This is the environment that David Eby has created, and so we're going to see these closures, these diversions, until we can bring hope, until we can bring change, and until we can show that we have a path forward that is going to be able to deliver a much better healthcare system in British Columbia for British Columbians.
Yeah, the healthcare system seems to be one of the biggest concerns for many British Columbians is just access to healthcare, access, like for waiting time. I mean, I hear this over and over from people, wait times for surgeries, wait times just even to get in to see a specialist and stuff like that. And then access just to a family doctor. I had somebody call me the other day just begging to see if I could help them find a family doctor. I mean, that seems pretty desperate, right? So.
Well, it is, and I'll give you an example. At the Conservative Party, we received a message from an individual. His wife has a very aggressive cancer, and it's a very serious situation, and she needs surgery as soon as possible. And she's being told that she's going to have to wait at least 2 months. And he's desperate. He was in tears. He's desperate. He wants to get help for his wife, but this is what our healthcare system has become. And to me, that is just completely unacceptable. We have some of the best healthcare professionals in the world, but we have a system that is failing them, and we have a system that is failing the province. And that's why we need to be bringing change. It's why we can't be afraid to say it's broken and it needs fixing. And so that's what we've done. And we've gone out and looked around the world. We looked at the European, the Scandinavian models, even Australia, and we've said, okay, they're able to perform at a much higher level than we are. They're able to provide a much more detailed and comprehensive level of services than we can. Why wouldn't we want to use their models?
So there was some reaction as well from the BC United Party and saying you basically copied their homework. That hey, I also think that's very much flattery then, right? So you guys agree on that. It seems like they're saying that's their plan. And any thoughts on that?
I can tell you what their plan has been. I have been out talking about this for months and months. I've been talking about this since last fall, if not even last summer. And so I've been talking about this in every speech I've been giving. And what they did is they took my speeches, developed their platform, and then put it out before us. Okay, well, that's fine. Whatever. My perspective on it, quite frankly, is this is a two-horse race going into this election. There's only one party that can defeat the NDP, and that is the Conservative Party of British Columbia. And so it's great that, they support our healthcare plan that we put forward, which quite frankly, I think is far more comprehensive than what they put out. Good.
Yeah, I would say so too. I mean, if it's good for British Columbians and you guys both agree on it, I think that's great. Do you know what I mean? Yeah. There's a piece of common ground, right? So,
well, like I say, you look at what the NDP is doing and the damage they've created, this radical approach they're taking to governing this province. We need to bring that to an end, and we're willing to work with anybody that wants to come in and be part of our organization to do that. Because for us, it's not about being conservative or liberal or NDP or Green. It's just standing for what's right, fighting for the average everyday person.
Somebody shared with me the other day was like, it seems a little weird that like a doctor, like I interviewed Dr. Nordine, and then I interviewed that healthcare worker just recently, and the doctor is allowed to operate in his practice in Rutland and see patients, but he's not allowed to operate in that building over, the hospital. And it seems like it's almost like not in my house is what the NDP government is saying to these people that have been, restricted or fired, or however you want to go about saying it, that they can go ahead and practice and see patients, but not in their house. And then it seems odd, and then sending patients to Washington State and that it's okay there, but not again in my house. So it doesn't seem to be what this person was sharing with like a medical or scientific reason. It seems more based on an ideology or whatever their belief system, or not wanting to be wrong.
Yeah, it is the problem that the NDP have, is they're making decisions based on ideology. They're making decisions based on their socialist beliefs. They're not making decisions based on patients. They're not making decisions based on what is right for British Columbians. And you can see that in so many aspects, whether that's in parents and parents' rights that they should have, whether that's in the ideology in our schools, whether that's with our resource sector and the issues that they have. I think we've seen this time and time again with this NDP, and it's very unfortunate to be faced that, especially when it comes to healthcare.
Did we lose your lights over there?
Yeah, I think it's motion detected. Just give me a second here.
You got to squirm around a bit to get the lights coming.
I'll be right back. I guess I was sitting still for too long. Sorry about that.
There you go. Or maybe it's
hopefully,
related to that Microsoft outage.
yeah, as I was talking, it was like going dark, and I was like, "Oh, this is not working."
Didn't pay
Anyway,
the
that's
power bill. Is there anything else you want to share today in regards to your healthcare plan?
Well, I think the most important thing about healthcare in British Columbia is it needs to be available when people need it. Um, somebody who goes to a hospital in Surrey who's waiting 12 hours in an emergency room, and then other people say, "Oh, that was actually okay. That was better than the time that I had to wait."
Yeah.
This is what we've come to accept in British Columbia, and I think it's just wrong. We should be able to do far better than that. When you look at the way we stack up against the OECD nations, the Organization for Economic Cooperation and Development, we're near the bottom on almost all categories. The number of doctors per capita, the number of nurses per capita, the number of MRIs per capita. So we need to be brave enough to say change is needed, and we will deliver that for the people in British Columbia.
Yeah, and I guess if you want to leave a message for those healthcare workers, I like I said, I interviewed Terry there a couple of days ago, maybe it's a week ago now. She's quite emotional. She tried to hold it together while she was on air, but like it's, they've had to sell their home, take their kids out of school and all that kind of stuff just from, and she, she's dedicated her life to that industry, and they don't have an answer. Like it seems like, again, I think we did a story the other day where it said, like a nurse is being punished for some, inappropriate behavior, but it's like a 3-week suspension, whereas these people have basically been given a lifetime sentence.
Yeah, no, and I'll give you an example of a nurse in Mackenzie. She was, she wanted to keep her job. She was young. She took the first COVID vaccine dose. She had a very serious allergic reaction. Her doctor said, "Good God, whatever you do, please do not take a second shot." So she followed her doctor's advice and she lost her job. And
Yeah.
that's a community that desperately needs to have a healthcare worker like her working in the system. And what's worse is now, because of the Health Professions and Occupations Act, the doctor that gave her that advice could be potentially liable for up to a $200,000 fine and 6 months in jail because he wasn't following the prescribed direction that was laid out by the government. So this is what. So you got a health professional that has trained all his life, that has worked with patients, that understands what the needed for the patient is, giving the best medical advice that they can, and they're being potentially punished and even thrown in jail time for giving that advice. This is how bad our system has become, and how much ideology has been driven into the system, as opposed to being just focused on patients, which is why we called our healthcare policy for the Conservative Party patients first.
You seem to be getting a lot more visible out there. I see you on social media a little bit more. Are you? I guess you guys are working it as much as you can. When can we see more parts of your platform, and then like a budget and like I guess you're getting ready to govern if that's your plan?
Well, certainly, our plan is to challenge for government here come October. And we'll be putting out a few more pieces. I think maybe a few more in August. There might be a few things that we want to put out there. But the majority will start coming out in September, and then, of course, the rest during the election. And the question really on the budget is we have a huge question about the provincial budget just in general. It's hard to say exactly how our budget, our platform can be budgeted when we don't know how bad the books are really going to be. David Eby has said they're running an $8 billion deficit. It's the largest deficit in BC's history. And yet they have overestimated the number of housing starts. They've overestimated the GDP. They've overestimated the revenue coming from resources. They've overestimated a whole bunch of things as part of their budget. So just how bad will that budget be? And my guess is it's going to be a budget that's going to be at least $10 billion deficit, which is going to create a huge hole in terms of Conservative government that's going to need to come in and clean that up.
Well, we're already experiencing some wildfires here in the interior. And when will we hear a plan for forestry and for wildfire mitigation or wildfire fighting?
So that's one of the pieces that we are looking at. We might be bringing something like that out in August, and it'll just depend on sort of where things are at. I mean, obviously, not a lot of people are paying attention to politics during the summer months. We wanted to get healthcare out there because it's a very important issue. It's one of the top 3 issues in British Columbia and has been for many years. So we wanted that out there so that people can see it. And so I'm hopeful that we will be able to get a few more pieces coming out so that people can be more comfortable with who we are as the Conservative Party and how we plan to govern in the province of British Columbia.
Seems like we have a lot of top issues. It's hard to even do a top 10, right?
Well, I can rattle off certainly the top 5 or 6 or 7 for people, and that is, affordability, housing, healthcare, addictions, crime, mental health, and certainly the economy. All of those are up in the top 10 for people in British Columbia.
The big concern for the Okanagan is definitely the wildfire thing, and then we're hearing it from people that tourism is a little bit slower, and we're hearing it from people kind of like checking in too. Like, if I make a reservation, can I cancel if the fires come? Because people have already been conditioned to expect fires in the Okanagan, and then until we get a solid plan and mitigation, and people don't want to lose their homes and all that kind of stuff. I think like a better plan for forestry too. Forestry seems to be the answer, I think, but
yeah. And managing on the landscape, how we change that is going to be an important piece of forest policy and landscape management policy. Reintroducing fire on the landscape is going to be also an important piece. Better utilization of technologies and equipment that we have. Working on interface issues. There's a lot to bring out there in terms of how we should manage and reduce those risks. But of course, through the Okanagan, tourism is obviously a big factor, but so is the fruit industry, and that industry, whether it's grapes or whether it's peaches or cherries. I mean, it's just been devastated from what's happened in the weather over this past year.
I imagine you're traveling a lot. You're seeing a lot of British Columbia.
Trying to get to every corner of the province. It's been a very enjoyable schedule, and I think the reason why I say that, obviously, it means a lot of time away from home, and it's been some nice weather. It would be nice to be able to be home and enjoying that a little bit. But it's very satisfying going out around the province, meeting with people, hearing what they are, hearing the issues that they have and what their hopes are, and talking to people about what we are as the party, and continuing to build that grassroots movement. So this week, for example, I'm in Vancouver. I'm going to be in Richmond, Surrey, in Abbotsford, as well as on the island in Nanaimo and Parksville. So it's been be a good week this week, and then I get to go home for a day or two. Take care of some of the tasks that need to be done around the house, and then back on the road again.
I'll leave you with this last question. How many ridings left to fill for candidates?
I think we've got about 15 or 18 ridings that are left to fill for us, and so it's actually quite surprising as the Conservative Party of British Columbia, we now have had more than 1,300 people apply to run for the Conservative Party of British Columbia. Wow. It's been the response has been just massive right across the province.
So you're not out there trying to convince somebody to run, you're having to filter.
Well, that's the biggest problem, is going through, doing the vetting process, making sure that people meet up, looking at where we can do nomination races. Of course, we're running out of time in terms of getting teams in place. So it's a nice problem to have that level of interest in the Conservative Party and what we stand for and what we're hoping to be able to deliver for the people in British Columbia.
Our managing editor, Ian Burns, did a really good piece with one of your candidates, Eleanor Sturko, just recently on Dr. Bonnie Henry's report that she just put out too. So I don't know if you've had a chance to read it, but it's a good piece.
Yeah, no, it is. And I mean, Bonnie Henry, in my opinion, obviously, I mean, she won't have a job under a Conservative government. And I say that, I don't mean to be flippant in terms of saying that, but, the ideology she's bringing, both with things like she wants to expand the what she calls safe supply, which is not safe. It's very dangerous. She wants to double down on decriminalization. She won't have our healthcare workers coming back to work. I mean, she's doing a lot of damage to healthcare and to people in this province.
Who's the main driver of that? If we want to talk, I'm just going to leave it with vaccinated, unvaccinated workers. Who's the main driver? Is that Adrian Dix, Dr. Bonnie Henry, or is it Eby? Obviously, he has the decision, but who's the one that's hanging on?
Look, from my perspective, when something is not working in the province, when something's not happening, it's on the Premier. David Eby is allowing these things to unfold and happen this way in British Columbia. And he may say he doesn't support it, but he could very easily change it. And he's not doing that. And so the buck stops with the Premier. And should we have the honor of forming government, if there's issues, the buck will stop with me. I'm not going to be pointing fingers at other people. It's the job of the Premier to do what's right for the people in British Columbia. You should accept that responsibility.
Okay, John, that was great. Thank you for your time as always. You're always very generous with your time, and we thank you here at Kelowna Now. We had some really bad news in the media outlets again. We had Global or Chorus announcing they're laying off 25% of staff. It's still kind of with Bill C-18 and that out there, it's still a rough go for all of us in the media world. So we're hoping for a better day tomorrow too.
Yeah, let's hope. But thank you very much for having me on. I always appreciate the opportunity to get to have this conversation.
Thank you.